Welcome, and thank you for using MD Conversation. It is our sincere hope that this program enhances your discussions with your physician and allows you to be a more informed participant. This program is not meant to replace these discussions with your doctor, but simply to make them more meaningful. This module discusses bladder infections in women, including some background as to how infections occur, how they can be prevented, and how they are treated. You may use the player on your left to pause the presentation at any point, or to skip through areas of the presentation that interest you the most. This presentation is an independent production. The use of trade names and the mention of products does not imply endorsement by MD Conversation or its contributors. Information provided about medications may not be complete. Prior to taking any medication, it should be discussed with your doctor, and the full product monograph should be consulted. This drawing shows the key parts of the female urinary tract. Urine is produced in the kidneys and drains to the bladder through tubes called the ureters. The bladder functions to store urine and must regularly and completely empty it when full. Urine passes out of the body from the bladder through another tube called the urethra. A urinary tract infection, or UTI, is simply that, an infection involving any part of the urinary tract. Specifically, these infections may be referred to as kidney infections, or pyelonephritis, bladder infections, cystitis, or urethral infections, urethritis. Bladder infections are very common. Each year, approximately 5% of all women experience one. By the age of 24, at least 1/3 of women have had at least one infection. Overall, for any woman in her lifetime, there is a 50% chance of experiencing at least one bladder infection. While bladder infections are more common in young, sexually active women, they can occur at any age. Bladder infections have a bad habit of occurring more than once. Without treatment, most bladder infections will clear themselves. However, 50% of such infections will occur again. Even when treated, 20% of infections will recur. With all of this in mind, it is easy to see why bladder infections are one of the most common reasons for women to visit a doctor's office. In the United States, bladder infections account for 650,000 doctor visits per year and 270,000 urologist visits per year. More than $25.5 billion is spent each year treating urinary tract infections. So why is it that women are so much more prone to bladder infections than men? This can be explained mostly by differences in anatomy. The female urethra, or urinary passage, is short and straight, allowing easy travel for bacteria or germs into the bladder. The opening to the female urethra is also close to the vagina and the anus, where many bacteria normally live. Furthermore, sexual activity may act to bring these bacteria close to the opening of the urinary tract, and certain ones can then cling onto the lining of the urinary tract and travel into the bladder. It should be pointed out here, however, that bladder infections are not transmitted through sexual activity, so are not considered a sexually transmitted disease, or STD. An STD is an infection, such as chlamydia or gonorrhea, that is transmitted from one person to his or her partner through sexual activity. With bladder infections, the bacteria are already present in the woman's body, and sexual activity just brings these organisms closer to the urinary opening. Bladder infections are caused by only certain bacteria that can cling onto the surface of the urinary tract and travel into the bladder. If they are not cleared immediately, they will multiply in the bladder and cause infection. The body's reaction to this infection is called inflammation, and it is this inflammation that causes the symptoms that are felt, such as pain, frequent urination, and urgency. We have many natural defenses against bladder infections, including normal bladder emptying, which must be complete and regular. Also, women have a normal collection or flora of organisms in the vagina which do not cause bladder infections because they cannot cling onto the lining of the urinary tract. These bacteria act to suppress the growth of other bacteria which can cause bladder infections, so their presence is very helpful. The growth of these organisms depends on the tissues of the vagina being healthy, and this at least partly depends on the presence of estrogen. Proper basic hygiene and cleanliness, of course, also help to prevent bladder infections. With this background in mind, let's examine some of the ways that bladder infections might be prevented. We will examine healthy bladder habits, hygiene, sexual practices, the role of estrogen, and probiotics. While we encourage practicing all of these methods, please keep in mind that, in fact, very few are actually proven effective in clinical studies. Let us first of all discuss some very basic habits which are healthy for everyone's bladders. Drinking at least 6 to 8 glasses of water or non-caffeinated fluids per day ensures that we are well hydrated and that we will fill our bladder regularly. It also prevents the urine from getting too concentrated, which may be irritative to the bladder. We must also take care to empty our bladder as completely as possible. The key to this is to completely relax the pelvic floor and sphincter muscle, or urinary valve, at the start of urination. In order to completely empty the bladder, we must maintain this relaxation during the entire flow of urine. If necessary, take extra time to ensure that you empty completely, relax, and breathe slowly. Avoid straining to urinate whenever possible. It is always stressed that women should wear clean cotton underwear and should wipe from front to back after using the toilet to prevent bladder infections. Interestingly, these simple measures have never actually been proven to lower the risk of infection in clinical studies. It is also common teaching that women should empty their bladder before and after sexual intercourse. Water-based lubricants may also help protect against infection. Avoiding the use of diaphragms, cervical caps, spermicides, like those found in some condoms, and some vaginal douches is also certainly a wise idea. Many of these measures, especially the role of diaphragms and spermicides, have in fact been proven in scientific clinical studies. Estrogen is a hormone, mostly produced by the ovaries, which has multiple roles in women. Among other things, estrogen improves blood flow to the tissues in the vagina and the urethra, making them healthier. It also changes the acidity of these tissues and promotes the growth of the so-called good bacteria, which suppress the growth of the bad ones. Estrogen can be given as a pill, although routine use of this form is no longer recommended. This issue can be further discussed with your doctor if necessary. Topical estrogen, where the estrogen is applied directly onto the tissues, is the more commonly used form today. Topical estrogen is recommended when your doctor can see evidence that lack of estrogen is making the tissues weak or thin. There are 3 forms of topical estrogen: a cream called Premarin cream, a vaginal suppository or tablet called Vagifem, and a pessary called an estring. The usefulness of estrogen in helping to prevent bladder infections in women who are deficient of estrogen has been proven. There are many natural foods and supplements touted to prevent or treat bladder infections, the most notable of which are cranberry and vitamin C. Cranberry can be taken in 2 forms. Cranberry pills contain pure cranberry extract and are the easiest to take. To gain the benefit of cranberry through the juice form, the pure juice and not a cocktail must be taken. Cranberry is thought to help prevent bladder infections by preventing bacteria from sticking to the lining of the urinary tract. Disadvantages of cranberry include the added expense and the added calories taken in the juice form. Unfortunately, we still do not have definite proof that the use of cranberry will reduce the risk of bladder infections. Having said this, many women report having less infections while on cranberry products. It should be noted that drinking excessive amounts of cranberry juice can actually cause symptoms of frequent urination, burning with urination, and even some pain over the bladder, so caution must be exercised. Vitamin C has previously been touted as a simple way to help prevent bladder infections by making the urine more acidic. Unfortunately, studies have shown that vitamin C cannot actually make the urine acidic enough to be successful in preventing infections. It is also expensive, and therefore it is not routinely recommended. Probiotics are gaining widespread popularity in the health food market as natural means of preventing and treating disease. Probiotics are living microorganisms which have a benefit to the host. The most common example of a probiotic is the organism Lactobacillus, which is found in yogurt. Prebiotics are compounds like sugars, which aid the growth of these microorganisms. And symbiotics are a combination of the two, with yogurt being an example. Despite the widespread global use of probiotics and the millions and millions of dollars spent on them, we are only just now beginning to properly study these agents in trials to determine exactly which organisms, given in which form, for which conditions, are truly beneficial. In trying to prevent bladder infections, probiotics can be given in different forms. By mouth, they can be taken as a pill or in the form of yogurt. They can also be given vaginally in the form of a douche. The idea behind this therapy is that these agents will promote the growth of the normal flora in the vagina to suppress the growth of bacteria which can cause infections. The major problem with probiotics at this point is that we do not yet know for certain what is the best organism to use and how to best deliver it. Oral forms, like yogurt, also involve the ingestion of extra calories. And vaginal forms can be very messy. These agents are also very expensive. Although we are just now gaining some evidence to support the use of certain probiotics in the prevention of bladder infections, unfortunately, nothing presently on the market has been proven effective. Most bladder infections are easy to recognize. Women experience the sudden onset of frequent, painful urination and have strong urges to urinate. The urine may be foul-smelling, cloudy, or even bloody. The presence of fever, back pain, and vomiting may suggest that the infection has spread to the kidney. For most women, the symptoms alone are enough to know that a bladder infection has developed. To confirm this, a urine dip test is usually done in the doctor's office, and urine may also be sent to the lab. A urinalysis is a detailed look at the contents of the urine under a microscope. A urine culture is done to determine the exact organism that is causing the infection, and exactly which antibiotics that bacteria will be sensitive to. A sample of urine is incubated in the lab to grow the organism and identify it. It usually takes about 2 days to identify the bacteria and determine which antibiotics will be effective against it. So how do we treat a bladder infection? Beyond just taking antibiotics, efforts must be made to help clear the infection out of the urine, by drinking plenty of water and taking care to empty the bladder as best as possible. Some women are able to clear infections quickly this way if they recognize the onset of symptoms. Having said this, however, the mainstay of treatment is antibiotics. These are medications which can actually kill the bacteria causing the infection. We will go into these in detail in the next few slides. Antibiotics will speed the clearance of bacteria from the urine, and they will lessen the chance of having another, or recurrent, infection. At the same time that the infection is being cleared with antibiotics, some women may need to take medication to help control the symptoms caused by the infection. Phenazopyridine, also called pyridium or phenazo, acts to soothe the bladder and urethra and limit the burning or irritation sensation caused by the infection. If you take this medication, be aware that it will turn the urine orange, which can cause some staining of clothing. Finally, measures to help prevent a recurrence of the infection should be undertaken. The use of appropriate antibiotic therapy will help this to a degree, but other simple measures, which we have previously discussed, should be undertaken as well. Recommendations for antibiotic therapy vary widely, depending on the region you live in and the health authority you ask. We will not attempt to make any firm recommendations here, but simply to give some generalized information about some of the common antibiotics used to treat bladder infections. Please note that the situation for any individual patient is taken into consideration when choosing antibiotic therapy as well. Factors such as urine culture results, patient age, allergies, and the likelihood of pregnancy are all important. Keeping all of this in mind, your doctor will individualize your treatment to achieve the best chance of success. The first class of antibiotic drugs we will discuss is called the quinolones. These include, in no particular order, ciprofloxacin, levofloxacin, gadafloxacin, norfloxacin, and ofloxacin. Due to high resistance rates to other antibiotics, these have now become the recommended first-line treatment in many parts of the world. In many areas, resistance rates to these medications are low. Resistance is when an organism finds ways to resist or become insensitive to the effect of the antibiotic. These drugs are usually effective in just a few days. They can also be taken on a once-daily basis, making them convenient. A disadvantage of this class of antibiotic is its expense. Furthermore, certain patients should not take these medications, including pregnant women, growing children, and patients taking certain blood thinners and some other medications. Talk to your doctor or pharmacist or consult with the product monograph if you have any specific concerns about any medication. Another common antibiotic used to treat bladder infections is nitrofurantoin, also known, among other things, as macrodantin or macrobid. This drug has the advantage of low resistance levels, and high levels of the drug get into the urine. Because the drug mostly accumulates in the urine, it does not kill off the so-called normal flora of the vagina or the gut, and is less likely to lead to yeast infections after treatment. A disadvantage of nitrofurantoin is that it does not get into the bladder wall, so it is not good for more complicated infections. Similarly, it does not penetrate into other body tissues, such as the kidney, so it is not effective against kidney infections. For bladder infections, it sometimes also requires longer treatment time, for example, 7 days compared to 3 days of other drugs. Finally, long-term use of this medication may lead to side effects on the lungs and the nerves. The so-called sulfa drugs are actually a combination of two medications, trimethoprim and sulfamethoxazole. It is the sulfamethoxazole that is the sulfa-containing component. Examples of these medications include Septra and Bactrim. Sulfa drugs have the advantage of being very potent drugs for killing bacteria, and a short course is effective for most cases. These agents are able to get into the wall of the bladder, so they can be effective for more complicated cases. The main disadvantage of this medication is that many bacteria have developed ways to become resistant to its effects. In North America, depending on where you live, up to 18 to 25% of the organisms causing bladder infection may be resistant to these drugs. Side effects, such as stomach upset, are unfortunately common with these medications, and allergies to the sulfa part of the drug are relatively common as well. Finally, some serious side effects can be associated with these medications. It should be pointed out that the trimethoprim component of these drugs, with the trade name Proloprim, can be used effectively on its own in certain situations when allergies are a concern. The final class of antibiotics we will discuss here are the penicillin-type drugs. For bladder infections, we usually refer here to either amoxicillin or amoxil, or drugs called cephalosporins, which include the commonly prescribed drug Keflex. These drugs are generally safe and inexpensive and are able to get into the wall of the bladder to fight deeper infection. The problem again with these antibiotics is that bacteria have found ways to resist their effects. Generally, a longer treatment time is also necessary, and allergies are not uncommon. Finally, the dosing of these drugs can be a bit inconvenient, as most people need to take them 3 or 4 times daily. Many women who experience a bladder infection are on the pill for birth control. It should be pointed out that some antibiotics can lessen the effectiveness of the pill, and this should be discussed with your doctor if you are prescribed an antibiotic. Please press the Continue button to proceed with the presentation.